How to stop psychosomatic pain, and is this even possible? My research on this topic revealed shocking answers. Now, did you know that your emotions can manipulate an unseen influence over your physical sensations? Now, uncover here the latest neuroscientific research unlocking the secrets behind psychosomatic pain, where emotions intertwine with pain perception. And if you are new here, then make sure that you click the subscribe button and hit that bell to get notified so that you never miss a video again and an update. And also check out my playlist, Healing Transformation videos. Now, what is psychosomatic pain? Now, psychosomatic pain refers to physical pain or symptoms that are influenced or caused by psychological factors, such as stress, anxiety, or even emotional distress, rather than actually solely by sociological conditions or injury. Now, this type of pain is often very complex, and it can also involve intricate interactions between the mind and also the body. Neuroscientific research and studies have shown that psychological factors, it can modulate pain perception through various neural pathways and also mechanisms in the brain. For example, neuroimaging studies have demonstrated that regions of the brain involved in processing emotions, such as the amygdala, the prefrontal cortex, also plays a role in modulating pain perception. An emotional state such as anxiety or depression can influence the activity of these brain regions, leading to alterations in pain perception. Now, chronic stress has also been linked to increased pain sensitivity and the development of chronic pain conditions. Now, research has also shown that stress hormones such as cortisol can interact with pain pathways in the brain and also the spinal cord, amplifying pain signals and contributing to the experience of pain. Neuroscientific studies on the placebo analgesia have revealed the powerful influence of expectations and beliefs on pain perception. Expecting pain relief through a placebo treatment, it actually can activate endogenous pain modulation systems in the brain, such as the release of endorphins, leading now to actual reductions in pain intensity. Now, why is pain different for everyone? We develop a definition of pain through attitudes, through beliefs about pain that we've picked up throughout our lives. Now, men are actually often taught to ignore the physical signs of pain more than women. The result? Both genders have actually very different definitions of pain. And pain is also linked to emotional centers in our brain. And this means that how we feel influences our pain. And if we feel upset or depressed or anxious, our pain actually seems worse. Now, this is a common daily life observation that if you have a headache, but you end up having a pleasant day, then the headache doesn't really seem to bother you as much. But if you have a mild headache and then you also have to experience more stress throughout the day, it is highly likely that your headache will worsen. Feeling emotionally better makes it easier to cope with pain and vice versa. Now, how to stop psychosomatic pain? Well, first, what you need to stop is thinking that pain is where you think it is. Let's dive into pain perception and debunk the notion that it's merely just a figment of the imagination. Because our medical framework often operates under the premise of mind-body dualism, suggesting that our mental and physical realms function independently. Yet, when we consider the intricacies of the brain, this separation, it starts to blur. Now, the brain isn't confined to the skull. It extends seamlessly into the spinal cord with neural pathways intertwining throughout the body. And this interconnected web, it challenges the notion of distinct boundaries between the mind and the body. Think about it. Where does your brain really truly end? And the traditional view places it within the confines of the skull. But in reality, its influence actually extends far and beyond that. And neural pathways extend through the spinal cord, branching out to every muscle, organ, and also bone. Now, this integration defies the notion of compartmentalization within our medical system. Now, consider here the concept of bodily regions like the neck or the hip. Right? We often define these based on arbitrary boundaries, but the reality really is a lot more complex. Muscles in the neck, for instance, it may extend to the shoulders or the ribs, blurring the lines between anatomical regions. Now, these divisions are not inherent, but rather constructs of medical convention. So when we experience pain without a clear physical cause, it's not merely in our heads. The brain-body connection is profound, with psychological and emotional factors intricately woven into our physical experiences. Now, to receive a diagnosis, a person must endure a specific set of unexplained physical or somatic symptoms for at least a minimum of 6 months. However, the manifestations of these symptoms, they can vary greatly among those affected. They span from a wide spectrum encompassing everything from pain and also gastrointestinal issues right down to sexual symptoms. Now, despite their chronic nature, the exact location, type, and intensities of these symptoms, they often fluctuate over time. This is what brings me to emotions and how emotions can trigger pain in the body. But the type of emotion that you feel will determine the location of the body that's being affected. In short, pain is suppressed resentment and anger. After interviewing and working with 6,000 people while I wrote Metaphysical Anatomy Volume 1, which is about 722 medical ailments and the psychosomatic messages of these ailments in the body, I noticed a powerful pattern for every person, regardless of your race, location, and beliefs. So if you have pain, you might say, well, I'm not angry. Well, yes, that's exactly the problem. You are not aware of the anger. Hence why I say it is suppressed anger or even resentment. I call this silent anger. Most people suppress anger because they're not allowed to express anger. And we associate also expressing anger with what? Rejection, confrontation, loss, and even shame. So we suppress it. We also have different types of anger, meaning the reason why you are angry and potentially suppressing it. This can vary. This means the location where your pain is can change over time, or it can stay in the same place. Now, negative emotions such as anger and resentment become thoughts. They become layered into our words, our behavior, and also responses in life and messages that is sent throughout our nervous system, whether we realize it or not. And this subconscious repetition layers in the stress response of these negative emotions in our body as well. And it can become also blocked and suppressed. Now, the body, like anything else in life, has a threshold, and pain is the body's way of saying it has hit its threshold for dealing with negative emotions, such as suppressed anger. Now, what do you do with this information? That's a great question. Now, this video is about how to stop psychosomatic pain. Are you ready? First, we need to start by releasing the blocked negative emotion and also the need to have awareness of the suppressed anger, because it is through this awareness that you can really truly start to heal. So now let's start and take a deep breath. Become aware of your heartbeat. Feel fully present now. Giving space to that emotion. And bringing now your full focus and awareness to where you feel the pain. Imagine the emotions in that area of pain, when suppressed, can be linked almost like to a river that is blocked by a dam. And the flow of feelings is halted, causing pressure to build behind the barrier. Releasing emotions is like opening the floodgates, allowing the river to flow freely once again, restoring balance and vitality to the landscape. The beta brainwave state is great for pain release. And with me now, breathe in the mouth and out of the mouth 13 times. Breathe into the area where the pain is. And imagine you exhale out from that area. And you will feel a little bit dizzy, so lying down might be a good idea. And please also do not drive or walk while doing this. Let's start. Breathe into your mouth. Breathe out your mouth. Breathe in 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 your mouth. Breathe out. Breathe in. Breathe out. Breathe in, and on this breath, hold your breath for as long as you feel comfortable. And exhale. Dropping into that silence. Notice any messages coming forward, potentially answers as well. Very good. And if you want to find out more detail, the accurate hidden messages related to anger that is in your body, then you can download also my free psychosomatic guided list from my homepage at www.metaphysicalanatomy.com. And you can also go through my guided healing session by visiting www.guidedhealingsession.com. You're welcome. And if you found this to be helpful, then also like and subscribe our channel and also check out my playlist, Healing and Transformation videos.